Bengaluru's COVID-19 story has been moving along a very different trajectory when you take into account its counterparts like Mumbai, Chennai, and Delhi. Bangalore has been able to contain its infections to such a degree that, considering that the city has a population of over 1 crore, the active cases stand at just about 150 right now. And we've seen about 13 COVID related deaths in the past 3 or so months. How has Bangalore been able to contain the spread of the virus? I'm going to call on Harsha Bhatt to give her insights.
Hi, Karan. For me personally, being in Karnataka, this is not just the Bengaluru model. This is what we call the Karnataka model when we reported about it 2 months ago also. So they've followed this pattern which I put in, 5 P's. So one is protocol, preparedness, public participation and private partnership and proactive governance. So let's look at all of this. Preparedness. One thing is when Karnataka gave the country its first COVID fatality, everyone was almost certain that the numbers will rise, be the infection or the mortality. But thankfully, it has stayed low, both of these. And Bengaluru is the best example of how it is possible to fight this pandemic with all these things that we mentioned just now. See, when the first cases were announced, if you remember, stringent lockdown was put in place even before the Janata curfew. And from that time, when in March we were looking at 8 labs. Today we have 70 labs in the state, which is almost 1/10 of what's there in the entire country. I think the national number stands at 771, of which we have 70 here, and around 15 to 16,000 tests being done. So it is the first city in the country. Bengaluru is the first city in the country to also have announced a separate, exclusive COVID hospital. So that the COVID non-COVID patients weren't put together, and Bangalore also created a protocol for the handling. SOPs were dished out by every city, but Karnataka took the lead. Now, almost like whatever every other city or every other state in the country did after 2 to 3 weeks, we did it. We did it so much in advance. So, as far as our preparedness was concerned, we did very well. I think Dr. Devi Shetty also has been saying from the right in the beginning that it was important to be prepared so that we could handle. There was nothing to stop the pandemic, but we could only prepare for its handling. Also, if you see in other metros, like what is happening in Mumbai is really scary and sad. That people are complaining that the city corporation run dispensaries are not functional. There was no coordination between various agencies. Hospital beds aren't available. Now, it has turned into a nightmare there, but thankfully, this cooperation between various agencies that was fixed here in Mumbai, in Bangalore, right at the beginning, is what changed things. Like, see, the number is in thousands now. We were like what in double digits in March, but we've crossed 5,000 in Karnataka. But the policy that was started as far as contact tracing is concerned, aggressively they did it. The BBMP war room that was set up, they use technology very extensively to map the patients, to contact trace them, to track them, and even to have everybody ridiculed when we said selfie quarantine, but patients who are in quarantine were also being tracked. So it's been a holistic approach towards handling of this pandemic, which has helped contain the numbers. Also, we had written a story of how in a very small rural setup in Karnataka, in Kadur, the neighbors were also asked to be on a vigil. So every time a quarantine patient would even step out of his door just to stand and look around, the neighbors were calling up people or the district administration and, taking care so that the pandemic doesn't spread. So that way we can see that public-private partnership, as far as both the public enterprises and private enterprises, as well as people's cooperation, both these have functioned very beautifully in Karnataka that way. Like in Mangalore, we have seen it's a smaller town, it's a tier 2 city, but the way people pitched in to maybe provide for migrant labor. We didn't have a migrant labor crisis like other cities have had, right? Like in Bengaluru. Technology, like you had a Swiggy a Swiggy or a Zomato kind of a thing. They launched something called the Dasoha. Now, this is using technology to your benefit in the time of a crisis. An online dialing and calling for help would get a migrant labor in some remote corner of Bengaluru his share of food for the day. So even the common man has stayed indoors. I think you can talk about this better. For example, you've been in a containment zone, have you? Right, Yashwantpur, and your area was in a containment zone. So you can tell us better, because even after 1.2 crore population, right, of Bengaluru, the active cases staying at 162, and total COVID affected are what, 424, that is 0.003% of the total population. So definitely we've done something right. So what did it feel to be in a containment zone, and how did things go about there on ground zero?
Right, Harsha, it's very interesting to relate some of the points you're saying with actual experience that I had, because our area reported a COVID positive case and it was immediately sealed down. That's one thing that happened. There was absolutely rapid response. Second thing was that all the primary and secondary contacts was sent into quarantine immediately. So, which is something that you spoke about as well, that they've done excellent contact tracing. And our area was pretty much sealed down for over 40 days. So that's the kind of precaution that they were taking. They weren't taking it lightly at all. And also, they went for a more micro containment option rather than shutting down all of Yeshwantpur, which is a huge amount of area. They were shutting down specific zones where cases were being detected. Availability of groceries were always there. There was availability of milk. So supplies were taken care of. And containment was done in a very professional way. The other thing I noticed was that from experience, I feel like part of the reason why Bangalore has been able to contain its infections is because the people have also been quite active in maintaining social distancing and wearing masks and taking all the precautions necessary. Because even in our area, when the area was shut down, you could barely spot people out on the road at all. Most chose to stay indoors. So that was my experience with the COVID cases in Bangalore. But Harsha,
adding to just 2 points, Karan, that you mentioned, just to give you numbers. See, 424 is the total number we say affected in Bengaluru, but 1,840 primary and 5,759 secondary contacts have been traced by the BBMP. Now, you can make out the scale here, and the state that even Dr. Devi Shetty was talking about has 40 medical colleges, hospitals with over 800,000 beds. Now, that talks about our preparedness. So, yeah.
Absolutely. But Harsha, let me ask you this. Now we are, of course, opening up further, right? And the cases are on the up. Nowhere near alarming levels, but they are on the up. How do you see sort of Bangalore managing this situation now going forward?
Both for Bangalore and Karnataka. One thing, to go back to what you were saying, as far as the common man and his participation, Karan, maybe we should highlight this about how, resident welfare associations or tiny groups of people have come together to sail through these 3-4 phases of the lockdown. Because I was talking to one Mr. Rakesh Rai in Whitefield. Okay, he was narrating to me how they were managing different farmers who are otherwise struggling with their farm produce, connected them to resident welfare associations, and 1 to 3 tons of every product that they were connecting were getting sold every day. So a connect has been established. So from the people's end, when this was happening, from the government's end, there was easing of norms, there was facilitating transport and farmer trade, and that was happening. So even exotic fruits like avocado or cocoa, all these people who are otherwise selling for, say, if I have to just give you an example, if they were selling for something around 50 to 60 rupees, whereas the product would be sold for 300 rupees in a supermarket, this direct connection during the lockdown and people's proactive participation got him 100 to 200 rupees and a set of customers. So life was facilitated by people as well as those in power, and that is how Bangalore kept functioning, I think. And that also stopped people from rushing to markets, like what we see in Chennai. Traders and people also rushing to markets also turned into these tiny clusters, right? Which has been avoided in Bangalore, I think, to a large extent. Don't you see? We haven't seen much of people rushing to markets or shops, or that frenzied buying hasn't happened.
Right. Yeah, that was an experience, especially in areas that were sealed down. Supplies were very easily made available. So Harsha, thank you so much for your insights. I think there are lots of lessons in it here for other cities, especially the metros.
Especially like Mumbai, Karan, like the battle is on, right? And sadly, Maharashtra has given us our new share of numbers. Like in my part of the state, Udupi, you were seeing very, like, not even single digit or double digit numbers until last week. But suddenly we have had 200 cases every day, and today I think in the last 1 week we've seen highest cases in the state. But even then things are in control, because you can see like one single thread that you can characterize the entire handling is staggered, be it locking down or opening up. The state has planned meticulously and tried its best. Today is almost the second layer of opening up, right? Like the temples, the malls, and other places of public gathering are opening up. The migrant crisis happened or whatever, through this staggered and constantly monitored. So through these two approaches, like while a lot of people criticize the many U-turns that the government was taken, you could see it more like a responsive decision making, because situations were arising with a new day every day. So this kind of a proactive governance, like there have been issues defying quarantine. I think yesterday you saw the corporator of Padra and Pura having a road show, and so people have been flouting norms, but then they were arrested. There was stringent action taken place. So the fight and the efficiency of the fight has been consistent. I think consistency and this staggering, and that's all I think leaders are now also requesting, that people from Maharashtra are coming back. This reverse migration is affecting us, but let it be staggered. Like, let the movement be staggered, so the treatment can be offered to all these people coming in, because clearly they are not getting it in the same in their states, in Maharashtra or elsewhere. That is why they're moving back. So the staggered and consistent approach of Karnataka, I think, has sailed it through this, the worst times, and I hope and sincerely believe that the worst is over.
Great. Thank you so much, Harsha, for your insights.